Ladies and gentlemen, the next speaker is Mr. Gullapalli N Rao, who is actually Dr. Gullapalli N Rao, I must correct myself, who is going to talk about building self-empowered teams. And it's important to understand how we are learning from one of the eminent personalities. He is none other than the founder of our L.V. Prasad Institute. How many of us have gone past KBR Park, please? Yes, as we drive past KBR Park, whether to the right or left, we can't stop just once turning our head around. Of course, Dr. Nageshwar Garu's profile is very much there. I would like to just, without taking too much of your time, add a couple of things. When I had the wonderful opportunity to meet him, I told him, sir, I must acknowledge how my mother was well treated in this hospital. It's unique, it was different, and my mother was really elated with the treatment. Then he gave us two little things. We don't train our people very much on many things. We tell them only two things. Look, smile, it doesn't cost. The second thing we tell them is check if someone is lost and help them. And ladies and gentlemen, that has been the motto. On that day, Ravi and I, we were coming down the lift, and a couple of young girls, they were trying to find their way through the hospital. Then one lady, she was just an attender, she was just walking with some of her things, and she stopped and said, "Kahan jana hai aapko?" And they said, "Oh, we are looking for something." "Nahi, aap galat jagah pe ho, go to the third floor." That, we spoke to him and we walked out, and we have practically witnessed. When somebody is talking about building leadership teams, inculcating culture into the team, the behavioral aspects into the team, that has been practically demonstrated by none other than Dr. Nageshwar Garu. It's a privilege, sir, to have you here. May I request you to address the audience.
Srinivas Garu, Ravi Garu, members of the Executive Committee of PMI Pearl City Chapter, ladies and gentlemen, when I saw the theme of the conference today, defining the next generation project management, I'm a little surprised because I belong to the past generation. So why am I here in a conference where the theme relates to the next generation? The second thing that intrigued me is talks about management. I'm an uneducated manager at best. I never had any formal education in management. All the formal education that I had was only in medicine and in ophthalmology. So I'm making myself very clear right in the beginning so that you don't expect too much from me this morning. What I'd like to share with you is a journey we had over the past 28 years of building a healthcare organization in an area where there is immense need in our country. As most of you know, or all of you know, Healthcare is a major issue in our country, and it's going to be even greater in the coming decade or so, because we are going to have this convergence of the diseases of the past, the burden of which we haven't eliminated yet very successfully, the tuberculosis, the malaria, the leprosies, etc. And to that soon we are going to add the burden of the so-called chronic diseases, the heart problems, cancer, joint problems, etc., etc. When these two groups converge, we are going to have a major crisis in healthcare in our country. Having been in this area for nearly 4.5 decades, it worries me that there is no big vision for the country to forestall this disaster. So what we began 28 years ago is a small experiment. A small experiment in one small area of healthcare, namely eye care. I lived in the US before that for about 12 years, and then came back to India with the dream of creating a high quality tertiary care eye institution that would encompass clinical care, education, and research in that particular area. Essentially, a replication of an academic medical center in the United States. That was my limited dream in the early 1980s before I moved here, eventually in October of 1986. And we had no local standing. I never lived in Hyderabad before. The longest I ever stayed in Hyderabad before that was for 5 days. The only reason we chose Hyderabad was it was my home state, and also it is geographically relatively centrally located in the country, and that we had a chance to attract the best talent from all over the country. And in fact, that happened. Today, in our team of over 1,500 people, we have people literally from Kashmir to Kanyakumari, from Bengal to Maharashtra. That has made a big difference. There are several factors that have influenced our genesis 2 years after they are with us. Each of them is sent out for a year to work with the very best in the world in their field and come back and develop that niche area in our institute. And that's how we are what we are today. We have touched about 20 million people in the past 28 years. We have trained over 18,000 eye care professionals from around the world. 80% Indians, 20% from other countries. We have published over 1,700 plus peer-reviewed journal articles through our research. We are the only eye institute in India with 4 Bhatnagar awardees in research. So we're very fortunate that we had this mix. While doing all this cutting edge on the one hand, we are presented directly in 120 rural areas with our primary centers, providing high quality care to the neglected people in all those 120 locations. So that's what made us special. And that we have become special because of our special people, special teams. These are all our people from the rural areas. Many from underprivileged communities. Many from underprivileged families. So we can create world-class people out of them. And together they made a world-class institution. And all that we try to manage, Ramam and I, is to hold the team together and make sure we are sustainable. The money that we generate from the 50% paying patients, we are fortunate. From the Birla family to the poorest, we have patients. It's the wealthiest of India that cross-subsidizes our less privileged patients. The money that we generate from them today pays for 85 to 90% of all our operating expenses. The remaining is through grants and other kinds of fee. And for all the capital expenditure, we mobilize funds through grants, philanthropy, and we also have a royalty stream from one of our research products. So that's what our institute is, 28 years long, 28 years old. A fantastic journey. Certainly when I am on my deathbed tomorrow, if somebody asks me, have you made a difference? I can smile and say yes. Certainly we can, as we move into the future, we have immense opportunities still. We are at a stage where we are unable to accept all the opportunities that are coming in our way. We are turning away, turning down many opportunities. And that we have to build. Our strength has to increase. For all that, I think we really have to look up to all of you and help us to develop projects of the next generation. And to all of you, I'd like to thank you for giving me this opportunity to share some of our experiences and hoping to work together with all of you in the future. Thank you all so much.
If any of you have any questions, Mr. Rao can take a couple of questions. Dr. Rao. Yes, Dr. Rasul. From a doctor to another doctor.
Dr. Rao, this is Dr. Rastogi, but not medical doctor, PhD doctor. First of all, let me compliment you and your organization. This is really illustrious. And we have heard a lot about it, although I have not utilized the services. There was no need. But my carpenter did. His son was treated. And the way he narrated was really very touching. So, great thing for you. But I have a question for you, because you are from medical fraternity, not from LV Prasad, but in general medical fraternity. One, we have a big, our country is still emerging. And there's a very large number of people who are they need the help, but they can't afford. So there's a big gap between the demand and the supply of the facilities, medical facility in general, where eye care is only one of them. How do we meet that demand? Second, the cost is prohibitive. LV Prasad may not be the case, but many others, So the fundamental questions looking to the next generation project management is how do we increase the capacity to double without much investment? How do we cut down the service time tremendously? Even my carpenter had to wait for 15 days to get the appointment, how do we reduce it to 2 days? These are the questions which, how do we handle?
My belief is there is enough money in the system to handle our healthcare problems in the country. A couple of years ago, when we were looking for the budgeting of the next 5-year plan, I was invited to be part of the committee that was looking at the non-communicable chronic diseases group by the health ministry. And they were asking for, I believe if I remember right, 40,000 crores a year or something for that group. The man from the Planning Commission, who was also part of the committee, said, no problem, that money would be available. But how do you propose to spend it, because you are not even able to spend 20,000 crores now? So we have to energize the entire system. The engine is not moving well. We have to energize the engine to be able to absorb all the resources that we have already available. Today, I don't think we have to build any more hospitals across the country. There are enough number of hospitals. There are enough number of beds. I would bet more than half of them are vacant if you take across the country. Half the capacity is underutilized. While on the one hand, there are many busy places, usually in the private and non-governmental sector. In the governmental sector, the capacity is grossly underutilized. So that has to be fixed. Second is the model for our country, I strongly believe, is what we are trying to do. A not-for-profit model that can take care of all sections of the society, from the wealthiest to the poorest. Corporate has a limited role, taking care of the top 10% of India. It's the government hospitals that have to be made better, and the system to be made better, combined with the not-for-profit sector that has to address the problems of medical care. In terms of waiting list, why do we have a waiting time? It's because there are not enough number of facilities and organizations. Even in Hyderabad, while we have a waiting time, there are other hospitals who don't have patients for today. So how do we bring that balance is the question. These are all the things that have to be tackled at a macro level in proper planning, proper distribution of resources, and proper allocation of people who need services.
Can you influence those bodies to come together and address this problem? And especially now we have a great Prime Minister who is very energetic. Can you influence the people like him who can, take up this? I'm just saying, because you should go beyond your organization now.
On my part, I've been trying both at the state, national, and global levels, all three levels. But it's not easy. Yes. Regrettably, the government of India has actually cut down the budget for healthcare last year and this year. So health doesn't seem to be on the radar screen of our powers that be there in Delhi.